Hi, it's Dr. Brad Guyton, and we're back with our Smile Power Hero of the Month. Dr. Katie McCann is with us today. She's the owner of Aurora Modern Dentistry. Katie, great to see you. Thank you for joining us.
Yeah, thanks for having me. I'm excited.
Yeah, congratulations on all the work you've done. And boy, you've been busy the last 3 or 4 months with all this stuff going on. This segment will air probably sometime in July. And we've seen a pretty challenging time the last 3 or 4 months for dentistry. How has your office responded to this pandemic in the last 3 or 4 months?
Yeah, this time has been really tough. I don't think anyone could have predicted something like this. I started 10 years ago in the middle of the recession, so I've been through tough times, but this is a whole nother level. We went from seeing about 350 patients a month, producing over about 400,000 a month, to only seeing about 30 patients a month. And so we took drastic measures in our office. That way we could keep our doors open and keep running for after the pandemic. So we went from a team of about 15 to down to a team of 3. So it was myself, a manager, and an assistant. And, we've always had extended hours at my office, but it was me working Monday through Friday, 8 a.m. till 7 p.m., and working Saturdays and Sundays as well. So it's been a trying couple of months for sure.
But really stay busy during some of the restrictions, because I know your office and some others really took an angle at we're going to keep people out of the emergency room. And how did that work out for you?
Yeah, so I was really passionate about making sure that we could serve the patients that had dental emergencies. I did still have specialists that were able to come into my office to serve, patients with specialty care. But in my mind, it's essential to keep patients healthy, because if they're fighting an oral infection, their systemic immune system is going to be compromised. And if it's compromised, they're more likely to contract COVID. So I wanted to make sure that we were open and available to patients as much as possible. We actually started getting known as the office who would take in the frontline healthcare workers to see them. What happened was one of my patients, who is a nurse, and she happened to be a COVID nurse during this time, she had an abscess, and she called. We got her right in to get her treated. And so, she just kind of kept spreading the word when she went back to work. We saw quite a few frontline healthcare workers during the time who were maybe unable to get into their own offices. But I think it was the amount of stress that they were under, but their dental emergencies were spiking. We had lots of abscesses, lots of fractured teeth. I actually have a little group of pulmonologists that now come to my practice because of that.
Yeah, no, I mean, what a great service you did to provide help to those frontline workers. What kind of message do you have for patients now in terms of, is it safe to come back to the dental office, and what special protocols are you engaging in to make sure it is safe?
Yeah, I mean, it's not only safe, but it's essential. Oral health care affects your overall health. So as I mentioned earlier, if you're fighting something in your mouth, your whole body is not going to be healthy. So what we know is that a lot of patients who are not faring so well when they get COVID are the patients that have heart disease, diabetes, COPD, and other comorbidities. And those patients are also the ones that have dental issues as well. So it's really essential and important that we help keep their mouth healthy so that they can better fight off this virus. Safety precautions that we're taking. So the team members in my office, we actually have the ability to test for COVID. So any of my team members can get tested at any time. We take all of our temperatures twice a day. We're also fully garbed out in hazmat suits pretty much. We have the N95s, the level 3s on top, face shields, gowns, booties, everything that is required. And then for patients, we're just, really keeping everybody safe. When someone comes in, they have to call us before they enter the building. We only take one patient in at a time. We take their temperature. They fill out a COVID questionnaire. We escort them right back to their operatory, complete the procedure and then checkout process in the operatory, and they go out the back door. So we're able to keep everyone separate and everyone's safe that way.
Excellent. Yeah, it's such a great example of some of the best practices that are going on out there. So looks like we have a visitor in the background.
Yeah, sorry, my dogs are going nuts right now.
Hey, we all get to learn who has dogs at home, and I have this. Yeah. My dog's under the table right now. So so one last question. Just looking forward, you mentioned the ability to test patients and team members. I mean, I could see that becoming kind of part of a protocol as testing becomes more effective and especially less expensive. Do you feel like testing and this new level of PPE is the new normal for a while?
Yeah, I definitely don't foresee anything changing anytime soon. You know, HIV was around for a while, and then when it became widespread, we just started wearing masks and gloves and sterilizing instruments, and now that's the new normal. I think that's going to be the same for COVID as well. I think there's going to be a shift from the patient experience, which is what we were really focused on prior to this, more to patient provider safety. So unfortunately, I do think the patient experience, might fall by the wayside for now until we can get everything under control, because safety is of utmost priority. I also think there's going to be a place for antibody testing. Once we can get those results really quickly, we'll be able to test, staff members daily. We can test patients as well when they come in. So I think that's probably what we're going to be looking forward in the future.
Great. Well, I really want to thank you for all you've done over this tough time, and the best of luck to you and your team members going forward. And thank you for being a good example of how a dental office should operate and prioritizing the safety of patients first. So it's Dr. Katie McCann. She's the owner of Aurora Modern Dentistry. Thank you very much, Dr. McCann, for being with us.
You're welcome. Thanks for having me.
Stay healthy.